This is a brief overview of the healthcare professions for examiners and investigators. Understanding the various types of providers and caregiving functions is important for auditors, investigators, and others who are understanding the roles that each play in compliance, service delivery, billing, revenue cycle, and documentation. This is not a comprehensive review, but rather a brief summary of the major types of providers and their roles in the healthcare system. The doctors. Many different types of doctors practice medicine. Chiropractors are those who diagnose, treat, and prevent mechanical disorders of the musculoskeletal system, especially the spine. Dentists deal with oral health, such as teeth and gums. Podiatrists treat issues with the feet and lower extremities. Optometrists deal with eye issues. The traditional physicians are medical doctors and osteopathic medical doctors. Both are fully recognized and receive essentially the same training. Both can then branch out into being a generalist, specialist, or surgeon. A PA always works in collaboration with and under the supervision of a doctor. Based on state law, these duties can include performing physical examinations, reviewing a patient's medical history and their symptoms, developing a treatment plan, and prescribing certain medications. Typically, these PA positions require advanced degrees. A surgeon is a kind of doctor who treats patients by using their hands, typically by performing surgery. Surgeons are physicians who specialize in treating injury, disease, and other conditions by the physical removal, repair, or readjustment of organs and tissues, often involving cutting into the body. Like their colleagues, surgeons can practice general surgery or can have specialties and subspecialties such as heart surgery, cardiovascular, or brain surgery, neurosurgery. A surgical first assistant, often referred to as the surgical assistant or simply a first assist, works in the operating room to assist and support the team and their needs. They hold open incisions, select equipment, stop bleeding, close the incision, and conduct other technical tasks. Nurses are the backbone of the healthcare profession. Workforce census data from 2023 shows that there are just over 3.1 million registered nurses, and there are an additional 630,000 licensed practical nurses or vocational nurses. Nursing integrates the art and science of caring and focuses on the protection, promotion, and optimization of health, the prevention of illness, the facilitation of healing, and the alleviation of suffering through a compassionate presence. Nursing aides and care aides provide basic care under the supervision of an RN or an LPN. Allied health professions are a category of health professionals that provide a range of diagnostic, preventative, therapeutic, and rehabilitation services. They apply their expertise to prevent disease transmission, diagnose, treat, and rehabilitate people. They also perform a range of technicals and support functions that deliver and support direct patient care, treatment, diagnostics, and health improvement interventions. Most of these have extensive training and educational or experience requirements. Let's talk about the behavioral health services and professions. These are typically mental health and substance use. They affect the patient's overall well-being and can work in inpatient facilities, such as hospitals and psychiatric facilities, or outpatient facilities, such as community mental health clinics. Healthcare professional job titles in the behavioral health can vary by state. For investigations into behavioral health issues and care, it is essential to understand who actually provided the service, since reimbursement can vary substantially. For example, physicians and clinical psychologists are paid a reimbursement rate of 100%, while services provided by a mental health counselor can be paid between 75 and 80%. Some services provided by mental health professionals may not be covered by insurance or Medicare because they are experimental or not scientifically validated. This is why it is so important to understand the titles, roles, and capabilities of different health professionals. When you are conducting an audit or investigation involving a healthcare professional, there are generally three areas to consider. There may be additional ones based on the nature of the profession, the context, the allegation, or the issue under review, but these are a good start. First, it's important to research the laws and regulations in the state where they are licensed to practice. You may also need to examine applicable professional standards, such as those issued by their professional association or regulatory body. It is vital to have a clear understanding of the scope and limitations of their role. Second, and this is especially critical for non-doctors, who is supervising their practice? Record keeping is also an essential requirement for all healthcare professions. Are they keeping accurate records? Are there any red flags in the documents, files, or electronic health records? Finally, we want to look at the person's background, their history, training, and education. We want to examine licensing history in all the states in which they practice. Any complaints should be examined in detail. Any disciplinary action or resolution is also important. Healthcare cannot happen without people. As professionals ourselves, we need to have a deep appreciation of the industry and the individuals who work in it. While the overwhelming percentage of doctors, nurses, and healthcare professionals are doing the right thing, trying their best, and giving their patients good quality care, there are some that are not. And that's why we need to help educate everyone about the benefits of compliance and the consequences if they do not. Hopefully this video has been helpful. Feel free to leave a comment or provide any feedback for future modules.